even though we're making technological advances because of the way technology is growing at the pace, when it comes to actual treatments in medicine, the application of a new drug or a new method of treatment takes a long time before it filters down to an actual patient. In fact, there was an interesting study that was published in American Journal of Medicine where they showed that between the discovery of a new method of treatment or a new drug out there, it actually takes an average of 20 to 25 years before it's available to every patient. And they equated that with the retirement of a whole generation of physicians. Because medicine, unfortunately, takes a long time to become a doctor, and a lot of physicians become very comfortable. They have to maintain a livelihood in actually practicing only what they have learned in their training. And what happens with that is that obviously their patients are only going to continue to receive the advice of what the doctor's training was. And I don't necessarily fault them, you know. So very few of them would want to step out of the comfort zone, learn newer things. So that is one part of it. So I'm extremely excited about being here, and I want to applaud IFAH for putting together this conference in a very difficult year, because recognition in healthcare does not come easy, you know. We don't have championships, we don't have Hall of Fame, we don't get to, you know, open champagne bottles and pour it on each other. For us, we're trying to deal with human body, which is imperfect in so many ways. The application of science is imperfect in itself. So it's good that we can have organizations like IFAH which bring us together for this 2-3 day event where we can talk about what we genuinely feel is important in healthcare, which is ultimately taking care of the patient. And each one of us, in a flipped second, can be that patient. So I did put together a lot of slides because a lot of my slides are very graphic as per my staff. So I didn't think people right in the morning after breakfast would be wanting to see. But I have a story to tell, and no disclosures. I'm just a practicing physician. I'm not at the helm of a multi-million-dollar company trying to promote anything. But I started off in Bombay, India, got trained as a surgeon. And as I finished my training, I got an opportunity for a research scholarship to come to the United States. And that used to be pretty huge in those days. We're talking about the pre-internet world, you know, where you would have to wait for letters to come in a month or so. And I was super excited about being a surgeon and operating from morning to night. Most of my emphasis used to be on doing procedures until I realized that what was I doing for my patients, you know, the collateral damage that comes with open surgery. Now, there is clearly a role in certain indications, but my interest was mostly in sports medicine, orthopedics, and keeping people active. And even though in the United States I moved toward a less invasive approach to doing things, I still felt like the downtime, the rehab required by these patients was unacceptable in terms of the impact it would have on their life. Because patients who come to me are not, when you're active and you play tennis, golf, or whatever, even if you're a weekend warrior, you really do not have a disease. You know, you just have an injury or an overused condition. And you love doing these things, so you're willing to pay the price. You live with those aches and pains until they get to a point where they prevent you from being the person you want to be. And then in 2008, I used to be faculty, University of Washington, Seattle, and I was visiting India, and I was called to see a patient. This was a lady in her early 60s who was a teacher of physical education for the past 25, 30 years. Same high school, had really taken care of her body well. Obviously, she's in physical education. And was getting close to retirement, has some knee pain and arthritis, expectedly, as we all are going to have by that stage. Sought a consultation at a reputable hospital and underwent knee replacement surgery for both her knee joints. The reason they wanted to see me was because when I went to see her, she was in a chair with both her knees wrapped in bandages that were soaking with pus. So unfortunately, she developed an infection. And now it gets even more complicated because she's got metal inside the artificial joint, and that will have to be removed in order for this infection to heal. That means she will have to go through months of antibiotics, not being able to walk because she's not going to have a joint until her infection heals, and then she will need another surgery to go in because obviously her original joint has been thrashed. It's in the bin somewhere. And that had a significant impact on me in terms of that this should not be happening to anyone who has led a decent life, does not have any other medical conditions, was looking forward to traveling the world after retirement, and is now in this situation. We talk so much about longevity. You know, there's such an obsession with longevity in all areas. People are trying to sell you how to live longer. You know, you go on, I find it fascinating, you know, when there are TED Talks by 40-year-old people talking about how to live 100 years. You know, if I want to hear from somebody who's actually made it to 100. And usually that person will tell you, he eats ice cream every day, smokes a cigar, and, you know, and you got this 40-year-old trying to sell you plant-based diet and intermittent fasting and, you know, all that thing, right? I mean, those are good things, but, you know, after all, we are all individuals, and we have to see what works for us. So when I got back to United States, I started thinking about there has to be something that maintains the quality of life. The emphasis in healthcare, as much as it is on treatment and cure, and obviously extending our lifespan, the quality of life is today your best day of your life, is how this day should start and end, because tomorrow is not guaranteed. And that took me on a journey towards the path of cell therapy. And cell therapy is basically addresses the fundamental way of how our body functions. Each one of us right now, from the time we were conceived, our cells have been multiplying. Constantly old cells die and new cells are formed. That is the fundamental concept of our existence. Every 7 to 9 years, we are not physically the same person in the sense that all the cells in different organs have turned over. In fact, we have a disease called cancer only because our cells multiply. And when that multiplication goes out of control, it forms a tumor. So the liver was supposed to form 100 cells today, and it forms 100,000 cells. It becomes a tumor in that organ. That's what cancer is. The cells, talk to any pathologist, the cells in a cancer look like exactly the native cells of that organ. They're just too many in too small a place. So if our cells are regenerating and repairing, how can we harness them to help regenerate and repair disease and injury? And that is what the past 10, 12 years of my life, my professional life, has been devoted to. And the word stem cell, unfortunately, is so loosely thrown around that, it does not get its rightful place in medicine. We are still fighting regulation, we're still fighting insurance, because people want to capture on the word and try to sell it. And so you could potentially get a stem cell treatment and really get no cells, or you can get a stem cell treatment that really works. And because of the lack of standardization, we are having a hard time moving these science forward and applying it to the patients, especially in the field of orthopedics and sports medicine, and hopefully to more. Because if you can regenerate and repair tissues, you bring them more in their natural state. And when something is more natural, your performance is likely to be maintained. And that is why the athletes have been traveling around the world trying to seek these treatments. Because for them, it's not just about getting rid of their pain, but they can't afford the performance to suffer. And I think that applies to all of us. Why would we be subjected to drugs, medications, cortisone injections, surgeries, when clearly we know that those are not good for us in the long run? There is a study now published where in knee pain, they took patients who had undergone arthroscopic knee surgery and found that they required knee replacement a decade earlier than patients who choose to just undergo physical therapy or rehab. Again, I'm not saying, I'm a surgeon at heart, that surgery has no role. There are conditions. If somebody has a complete ACL tear playing soccer, that knee is unstable and it needs to be put together, and we're not at a stage where cell therapy can heal that. But for a lot of the other problems that we have, playing and doing things, we can continue to stay active if we apply cell therapy properly. And then in the world of cell therapy, there is a big divide between the sources of cells. Where do you get the cells from? And most of these cells are being marketed now by using foreign sources, mostly from umbilical cord stored or donated by people when a new baby is born. However, we forget that our own body is a storehouse of cells. And the real potential in healing ourselves lies within our own cells. A lot of time people say, well, my own cells are very old. Yes, your cells are as old as you are, but their potentiation is significant. The number of cells that can be collected from your body is huge than anybody can sell you in a while. So a lot of work needs to be done working on our own cells. And one of the things I'm really excited about is how we can actually take your own cells and walk them back and try to create different organs and systems in the body. So organ transplantation, liver, kidney transplant happens because when those organs fail, you need something to take over the function. If we can, what is an organ, a liver or a kidney? It is a collection of cells that performs a particular function. Okay. So we have to get away from this concept of even thinking about organs as the way they morphologically or physically appear. Because the biggest risk in organ transplantation surgery is the immunosuppressive therapy. That's what killed Steve Jobs, not the liver transplant or his tumor. He actually had a very benign tumor that we could have kept him alive for many more years. But he chose to undergo liver transplant. And when you choose to undergo a transplant from a foreign donor, you have to be given a lot of immunosuppressives so that your body does not reject this organ. What if we were able to take your cells and develop cells that can perform the function of the liver? And then instead of thinking of replacing the whole liver with another organ that looks like a liver, just implanting these cells in your body and they take over the function of what liver was doing. How fascinating would that be? So that is my hope, that is my desire, that's my primary area of interest, is organogenesis going forward, so that we don't have to rely on foreign cells, foreign organs. We are prepackaged to heal and cure ourselves. And that's what we need to focus on. So I tell people, quality of life should be your goal. Longevity will follow. And then the real question, obviously, is who wants to be a millionaire? Right? Everybody. But what if I was to tell you that each one of you sitting in this room is already a trillionaire? Not a millionaire, not a billionaire. You are a trillionaire, because human body is made up of 1 trillion cells. And if you take care of your cells, you lead an active, productive life, and God forbid you have disease or injury strike you, your own cells will come to your rescue because you took care of them. Thank you so much for the opportunity. Sure. Any questions? I was originally under the impression I had a 10-minute time only, so. Yeah.
Are there any ethical concerns with organogenesis?
There shouldn't be, as long as we're talking about your own cells. See, this whole debate with stem cells went out of control because people initially started off embryonic stem cell, and they feel like if we have a cell that can grow into an entire human being, that's the holy grail of medicine. But that's not what the concept is. The concept is, how do you heal your body? And if your body can be healed with that takes away actually the entire ethical concerns with these cells, because you're not relying on foreign tissue. You're working with your own cells. So.
Is it limited? Do you think that process would be limited to certain conditions, or is it?
Yes. For now, yes. Yeah, it is. But as we were talking about, how now there are technologies being developed where we can take an adult stem cell from your body, which has already matured, because you're a fully formed adult, right? I mean, the important part why embryonic stem cells was on everybody's radar is because it's not mature, so it is capable of growing into anything. But then it comes with everything else that's bad. There are ethical concerns, and there are also concerns about foreign DNA getting into your body. But when we take your own cell, and if we have ability to walk it back to a more immature stage, and then stimulate it to grow into, say, liver cells or kidney cells, and we're not there yet, but that's where the emphasis of the research should be, and I think it's a much more realistic goal than trying to get to Mars, Because we got to first take care of ourselves, yeah.
What about stem cells for brain function, for autism?
Yeah, so that's where, sometimes the marketing, and you can go to these clinics in Panama and elsewhere where they are claiming to have cures or treatment for But the fundamental concept of stem cell is this, that it should be capable of generating the cells that are damaged, right? So when we talk about a knee joint or shoulder joint, the cartilage that's damaged, and is the cell capable of repairing and regenerating that cartilage is what we are interested in. When somebody is paralyzed, obviously the nerve cells, the neurons are which are damaged. And then the important thing is this stem cell capable of growing those nerve cells to see a long-term improvement? And I don't think we are there yet, except for in very highly controlled clinical trials. Same thing with diabetes. I mean, there's a host of patients who come to me and they want stem cells for diabetes, and it's advertised on Facebook and wherever. There are clinics in Thailand offering you $50,000 treatments for diabetes. So my first question to them is, why do you want treatment with stem cells? So I don't want to take insulin, or I don't want to take my medications, right? So it means that your body has to be in that status where these cells can generate what you're lacking. And if that is not happening, so the main question to patients is, because these patients do go back, autism, I mean, forget about my field of sports medicine. I mean, there are conditions for which people are desperate, MS, Parkinson's, and they're willing to spend as much money because these are really debilitating illnesses which not only impact the patient, but everybody in the family. But we're not still there where we can guarantee that these cells are going to translate into those treatments or be very effective in the long run. Yes, getting an injection and feeling good. I mean, I just treated another doctor, his knee last week, and he called me in 3 days and said, wow, my pain's already gone. And I said, this is not going to work this quickly. I'm happy your pain is gone, right? Because it's called something called the placebo effect in medicine. They've actually done studies at Mayo Clinic where they injected saline in one knee and injections, cortisone or Synvis, gel injections in the other knee, and they found 6 weeks out, patients in both groups felt the same. So we're not at a stage where we have those kind of treatments.
But aren't we fundamentally talking about two different paths this is going to go down? One, we're talking about regenerative medicine, where we knew something worked at one time and we're replacing that. Whereas when we start talking about diseases like MS and potentially autism, those might involve some kind of correction to the DNA sequence because it's a fundamental programming error.
Absolutely, absolutely. The answer may not just be the cell therapy part of it. There's a lot more going on, and gene therapy, and there's a lot more other aspects to this. So, but what stem cells have shown is a tremendous power to modulate the immune system. And that is the second part of it. So one is the regeneration repair, and second is the immune system. So for some of these kids, there's a study published in Autism out of Duke that actually showed some decrease in behaviors and improvement in communication. We're not talking about cure, but we're looking at marginal improvements because that is such a multifaceted condition that there's so much going in the body. And we don't realize. And same thing with cell therapy too. I could be treating two patients who are very similar in terms of what they are suffering from, and the outcomes can be entirely opposite because we're just starting to scratch the surface. But I think it's time for medicine to look for the answers within rather than more drugs, more medications, more surgeries to help us heal. Right.
I apologize on my ignorance on this topic, but the pricing, to my understanding, stem cells still very expensive, correct? Do you see in the future that being more available?
And that's where I feel that working on adult stem cells that come from our own body is, anytime you take something from somewhere and make it a product, obviously, there's multiple layers of pricing that come on top of it, But if we realize that these are our own cells and they're harvested and then they're processed, and I'm sure in time. And right now, we can't even talk about pricing because the procedure is not standardized. So it just depends upon how good a marketeer you have in your team, and he can sell anything. Because like I said, there are people out there with certain conditions where they're desperate for, an answer or a solution, and they would be willing to pay anything and maybe even feel good for a few weeks, but then they're back to where they were.
I didn't know that stem cell helped mental, like autism. That is brand new to me. I think it's fascinating. I was very aware of.
Yeah, this is the first time that it's come out, and but it's not, it's not robust, and one clinical study doesn't really tell us a whole lot. But I'm glad that they're working on things like that, and hopefully that answers your question. If you have somebody with paralysis, we're not at that point. A lot of research is going on to develop those neural cells and to implant them in the spinal cord or wherever the damage was, especially in traumatic. Same thing about diabetes also. We have two kinds of diabetes. The juvenile diabetes is the one where we are likely to get a handle much sooner, because juvenile diabetes, the pancreas just doesn't produce insulin. So these kids have diabetes from the time they're born. And I think there we are actually very close to developing cells that can produce insulin, which will be then placed in a biocassette and just inserted underneath the skin, and the body will grow the blood vessels into this biocassette, and then those cells will function as a second pancreas and automatically sense sugar. I mean, these kids might even have to get away from, they won't have to keep testing their sugar levels because the body will take over. So that's very, very promising. Type 2 diabetes, obviously, there's a lot of other things that need to be done before I tell these patients you even need any treatment, because it's going to come down to your lifestyle and your diet and your exercise and other habits. So it's important to understand where the application of cell therapy would be. But right now, if you have a tennis elbow or a painful knee or your spine hurts, there is no reason why somebody should be giving you cortisone shots. If we don't even have to go to full-blown stem cell therapy, let's just collect your blood and get PRP, platelet-rich plasma, which every other day you read in the paper, athletes getting it. It's on ESPN almost every Monday morning after the Sunday football games, right? So why is it not even that being done? Forget about the evolved stem cell therapy. What about platelet-rich plasma? Next time you go to your orthopedic surgeon, your doctor, and they try to sell you a cortisone or a Synvisc or some kind of foreign injection, just ask them, why not my platelets? Why not my platelets? That's the question. If there's one thing you can take away from this talk, is this question, why not my platelets? Because I want to continue to play tennis, I want to continue to hike, I want to continue to go on mountain biking for the rest of my life, to the last day of my life. I had a 70-year-old couple come to me, and I asked the husband, and they were into heli skiing, and they're 70. So the first thing they told me, they came to me for their knees, and they told me, don't ask us to stop. And I said, you came to the wrong doctor, because my whole focus is to keep you going. I never tell any patient to stop, because that is taking away a major part of your life. And they said, yeah, 10 years ago we were told knee replacement, and we didn't go through it. We still go, but we'd like to have a little less pain and a little bit more function. So we treated them, and it's been 5 years, and they still go for their annual heli skiing trips, and they're 20 days out there thrashing their knees downhill skiing. So that is the power of your own cells. And that's what we need to do.
Can you elaborate a little bit more? Because I'm going to go back to my doctor when I go back home. Because I had a work-related back injury in December. And so I've gotten two shots, cortisone shots, and may have to get a third one. So I would like to know, how does that, the platelet PR?
Yeah, so it's very, very simple. Our blood has 3 cells, red blood cells that carry oxygen, white blood cells that fight infection, and platelets. These are the smallest of the cells. They usually stop bleeding when we get minor cuts, but they also have about 8 to 10 different growth factors and anti-inflammatories in them. And so if we draw your blood and we spin out the red cells and the white cells because we don't need them, we're left with platelets suspended in the fluid of the blood, which is called plasma, and that's why the name platelet-rich plasma. And then that is just an injection, just the way you've been getting steroids. One other thing about steroids is very, very important, and people don't understand, that even when it is injected into your joint or spine or any area, it still gets absorbed into your body. It is just like taking oral steroids, right? So it's not going to stay inside the knee itself. So then it starts causing all the side effects that come with taking steroids, you know, and plays havoc with your blood sugar levels, and, you know, so it's not good. I mean, and it's unfortunate that the insurance companies are not even open to the idea of just approving PRP, platelet-rich plasma. We're not manipulating your cells. Even the FDA, it does not have any problem with that. And, you know, I have a lot of patients who've come to me in their 70s and 80s with so much damage that they have knee surgery next week and they don't want to undergo knee surgery. And I told them, it's too far advanced for you to heal with stem cell therapy, because that is also important. You can't have such an advanced condition. But then I said, okay, maybe we can try PRP and see if we can get you some relief. And they come every 6 months and get a PRP injection, but they're still in a much better state than undergoing surgery and dealing with its complications. You know, now, all of these are not marathon runners, but at least their quality of life is maintained. So those are the important questions. So along with all the technological advances you guys are going to watch or have heard in this conference, please think about your own cells and please take care of them, you know, because they'll be your best friend in the coming years. Yes.
Hi, Marianne Mass, and I'm a practicing physician from the Philadelphia area. And one of the things that I've written about, spoken about, advocated for is the fact that, you know, you brought up PRP and how the insurance companies aren't covering it. You know, what gets covered in hospitals is controlled pretty tightly by a group of middlemen that write contracts. What gets controlled and put on formularies is controlled by pharmacy benefit managers. Both of these organizations, pharmacy benefit managers and the hospital middlemen purchasing organizations, have the right to receive money from the drug companies and the device companies that are trying to get their products onto the formulary.
Yeah.
It's pay to play. That's a kickback in any other
Right.
in any other organization. And in fact, we know it's a kickback because they have an exemption under the anti-kickback statute. It was granted to them by our US government.
Right.
And that's creating lots of problems because we don't get innovations. It's costing people money because the kickback is a percentage of the cost of the treatment, the drug, the
Right.
device, et cetera. And, you know, I mean, I think we could be saving roughly about $200 billion per year and getting better, more innovative treatments based on some research that large organizations that I'm working with have studied.
Right.
So your comment would be great.
Yeah, it's unfortunate. I mean, that's where I think we have to distinguish healthcare. You know, unlike any other business, you know, we're not making electric cars and, you know, yes, I mean, Elon Musk is a great visionary. But what does he want in his knee when his knee hurts? What does he want? A steroid injection, which is what's going to be sold to him? You know, so we have to realize that, yes, we want to make profits in healthcare industry, and all these players that you named have a role to play, and they have businesses to run, and they have sponsorships. Some of these are probably sponsoring and paying for this event. But ultimately, we are also taking care of human beings, our own race. And if we do not have respect, when each one of us is a split second away from becoming a patient, then it's a lost cause. So that I think is why medicine is so challenging, even when you have better treatments and better ways of helping people. Thank you so much. Thanks.